This parent training presentation is brought to you by Stephanie and Sandy. Development begins in utero, and the reason it's important to remember this is because it helps us to empathize with the experiences of our newborn. For starters, why can't my baby just go to sleep in their comfortable crib without crying and waking frequently? Your baby has been snuggling inside a warm and moist womb for 10 months with a constant stream of nourishment from the mother's body. This hunger and thirst stuff is new. So these strange drafts of air and not being able to move around well don't feel familiar or safe. Most difficult of all, the only thing familiar to your baby is your smell and touch, so when that is gone, it can be very scary. Imagine how that might feel. As parents ourselves, we know how challenging this time can be for parents. All of a sudden, your responsibilities and priorities have shifted, and you may feel like life revolves around your baby. This can be tiring and stressful, and that's why understanding the importance of how you parent during this crucial time in your child's life is so important. Once you have the knowledge to make the best decisions you can for you and your baby, you'll be on your way. There are so many different ways of parenting. We all come from different cultures and backgrounds and bring our own life experiences, personalities, ethics, and beliefs into how we raise our children. Experts and scholars have studied parenting, and there are a couple of things that they have found. The first is that forming a secure attachment with your baby is the most important thing you can do to ensure their emotional well being, not only now, but for the future as well. The second thing we know is that there are variations as to how we accomplish this, depending on our cultural identity. We will explain attachment theory to you shortly. In the meantime, think about its main three functions. To provide your baby with a sense of safety and security, it helps them regulate their emotions by soothing distress, creating joy, and supporting calm. And last, it gives them a secure base from which to explore the world around them. According to attachment theory, the purpose of attachment is for the parent to provide an environment that is safe and secure for the child. Attachment allows a child to use their parent or caregiver as a place of security from which they can leave to explore and also to return for comfort and safety. There are four types of infant-parent attachment: the organized types, secure, avoidant, and resistant, and the disorganized type, insecure and disorganized. This table shows the connection between the quality of caregiving and the organized or disorganized strategies that the infant develops as a response. This establishes the type of attachment that is formed between an infant and their caregiver. Even when the caregiver is inconsistent in their quality of caregiving, the infant will establish an organized pattern of behavior in response to their distress. Only when the caregiver displays atypical qualities in their caregiving, usually relating to abuse, does the infant's strategy become disorganized as well as insecure. Infants whose caregivers respond promptly and consistently to the needs of the infant by picking them up, soothing them, and addressing their needs create an organized and secure attachment with the child as the infant learns to seek out their caregiver when they are distressed. Caregivers who are insensitive to the distress of the infant and respond to them by becoming frustrated or irritated, ignoring them, or yelling at them teaches the infant to avoid their caregiver when distressed and to minimize their displays of negative emotions because they cannot trust that their caregiver will respond positively. This creates an organized but insecure attachment style. Infants whose caregivers respond to their distress inconsistently and unpredictably by becoming emotionally overwhelmed at times, which amplifies the infant's distress, or by varying from attempting to be soothing to ignoring them, results in an organized pattern of behavior by the infant, in that they become harder to calm as they exaggerate their distressed behaviors in the hopes of eliciting the attention and care that they want from their caregiver. A disorganized and insecure attachment occurs when the caregiver displays aberrant behaviors, such as frightening or harming the infant by screaming and/or causing physical or sexual abuse, or possibly becoming dissociated and becoming emotionally detached and aloof and unresponsive for periods of time. This type of atypical behavior results in an unorganized, insecure attachment as the infant does not know how to respond to distress. This is most common when the caregiver has unresolved trauma. Insecure attachments to caregivers affects the physiological as well as the psychological well-being of the child. Children who have insecure attachments are more likely to have developmental delays, display behavioral problems such as excessive crying and feeding problems, or are more likely to suffer from infections and a failure to thrive. And later in life, they are at increased risk of learning and mental health disorders. Cultural influences such as lifestyle, socially normative behaviors, and parental strategies result in different types of personality traits and behaviors that are consistent within a culture. Cultural influences how people express their emotions. In Western culture, attachment is measured by an infant's response to their parents and their responses to being away from them or introduced to strangers. However, in some non-Western cultures, acceptable emotional expression is different and childcare is distributed among the community, so an infant's response to their parents being away from their parents or seeing unfamiliar faces will be very different than an infant raised in a Western culture setting. Attachment theory is based on Western culture's perceptions and behaviors. As a result, many of the interventions intended to promote positive parenting strategies do not include cultural considerations for non-Western cultural behaviors and lifestyle. Western culture views the primary role of the caregiver as one that provides the rich cognitive stimulation necessary for academic success and promotes individual expression of emotion and interests. As such, parenting strategies are focused on promoting these types of interactions between infant and caregiver. However, non-Western cultures may socialize their infants to follow the directives of their elders by including their infants into their daily routines and work aimed at providing sustainment for the family. The infants grow to focus less on their individualism and more on how they are a part of their family and community. The claim that attachment theory is universal may not be accurate or ethical, as there is limited research into how different cultural factors impacts the caregiver-infant attachment process and how these differences relate to Western culture and attachment theory itself. However, despite the questions regarding the applicability of attachment theory to all cultures, what is universal is that infants are less likely to suffer developmental delays, illness, or display problematic behaviors when their needs are taken care of promptly, consistently, and with caring and nurturing. Parental socialization has a significant and lasting impact on childhood, adolescence, and even adulthood. There are different styles of parenting. Parents who provide a loving environment filled with assurance, acceptance, and involvement, along with supervision, guidance, and discipline, are demonstrating the authoritative style of parenting. This style is linked to better psychological development, social skills, self-confidence, emotional maturity, and academic success. In contrast to the authoritative style of parenting, the authoritarian style includes strict discipline and controlling behaviors with less acceptance and assurance. This style of parenting is associated with lower levels of self esteem and higher rates of behavioral problems and emotional maladjustment. The opposite of authoritarian parenting is the permissive or indulgent parenting style. This type of parenting involves little discipline or guidance, but plenty of warmth, love, and acceptance. This style of parenting is also linked to behavioral problems, as well as lower academic performance and psychosocial maturity. A neglectful parenting style shows little of the warmth, assurance, guidance, involvement, acceptance, or discipline seen in other parenting styles. This type of parenting is associated with the worst parent child relationships, as well as the lowest academic performance, self esteem, emotional maturity, and the highest levels of behavioral problems and psychosocial and somatic distress. Cultural values and societal norms play a role in parenting styles and how they impact the development of children. While authoritative parenting styles are believed to yield the best developmental outcomes, indulgent parenting styles in European and Latin American cultures have also been linked to positive developmental outcomes, with children having a high level of self confidence and success. Authoritarian parenting styles have been shown to offer protection among minority families living in dangerous neighborhoods, as the parents keep strict control over the activities of their children and low tolerance for problematic behaviors, as well as also promoting higher academic success and with no notable increase in psychological distress. This indicates that circumstances, as well as cultural factors, also play a role in how parenting styles impact development. At present, in studies of parenting styles as well as types of caregiver child attachment, it is believed that the best developmental outcomes stem from high levels of care, nurture, acceptance, inclusion, and involvement. These factors are the ones most commonly associated with higher self esteem, academic performance, as well as healthier parent child relationships and better development of social skills and pro social and adaptive behaviors.